three amazing young individuals, one amazing individual who really spent the last few years dedicating herself to this film. We have not met, but I must say, as someone who pretends to be in entertainment through news, I should be so lucky to have half the talent you have. Congratulations on a wonderful film. Just give us some thoughts about what it was like for you in your heart and soul to put it together. Because you saw these kids through the years, either through film or action.
Well, I actually got involved in, my background's in fine arts, and actually studied sculpture and kind of fell into doing video. But I got into this field because my sculpture professor in undergrad had a child that was autistic, and I was doing a minor in psychology. This was in Connecticut, where ABA treatment was not very well supported in the mid-90s. And he handed me a couple books, and he said, "Here, come meet my son. Read these books, let me know if you can help me and work with him." So I was totally, I had no idea what I was doing, and I was working as an ABA therapist. And then I went through grad school, I moved to LA and realized that CARD was here and started working with them. So when Doreen asked me to work with her on this project, I had been doing primarily experimental video and installation art, and I've been teaching art at the college level. And so to me, it's been really important because I always really look back at the first child that I ever worked with, and how amazing it was the first time I got him to say hi to me without prompting, without just where, I don't know how many months it took for us to constantly get it, for him to say that was really just amazing and touching. And so when Doreen gave me all this footage of the 4 kids in the movie to watch and to pick out clips to use, and then I had the chance to go to their homes and interview them and their families, I was just shocked. I couldn't get over how incredible they were, how just like typical teenagers they were, and I was also really excited to, particularly I think with Nick, when Nick really understood and remembered going through the treatment, where I think all the other kids kind of just, was like, I didn't know even what was going on. I didn't remember this, but Nick remembered, and I felt like his insight was all of their insights were so valuable into what the experience is. And it's really just my hope that the general public starts, and the pediatricians, and my psychology professor in undergrad, when she showed us Ibar Lobas's video about ABA, turned it off afterwards and then told us, but this doesn't work. And I had been doing this with a kid for a couple months. So I, raised my hand and said, well, this is working actually. I'm seeing progress in the child that I'm working with. And she just kind of dismissed me. So it's really my hope that people see this and they realize that it is really valuable and it is really working, and that kids are improving and recovering, and pediatricians won't be telling other parents to put their kids in institutions anymore.
Well, this is the second time I've been at a premiere, and sorry, I kind of get choked up still. It was a tough road. I've kind of forgotten a lot of it because we've moved on. We've left that dark part of my life and Janet's life, our whole family. So I kind of get emotional, but it just makes me want to just, like anyone that's here and has a child with autism, you gotta get therapy now. I want to run out there and grab you and say, we can do it. That's how I feel every time I see it. So, and no.
You want to say anything, Doctor?
No, I also wanted to just, I guess this film is amazing. The people who worked with the kids who are here, one of them, Kathy Visconti, is here. Evelyn Kung and Vince Redmond couldn't be here tonight, but I just want to mention their names because I think that they're amazing individuals. We've worked together for about 15 years, all of us, and they need to share in this experience because they are people who dedicate their lives to this and have worked with kids for the past 15, 20 years or so, and I just want to applaud them as well.
I just want to give props one more time to ACT today. I'm very honored because I've been friends with Doreen and Stefan, her husband, and this isn't just a pat on the back. ACT today is doing very pragmatic, very real, very valid inroads into helping families. I was amazed at the last board meeting. 85 grants went out to help families whose children have been diagnosed with autism, and the early intervention, the early diagnosis, the early ABA. All of this, as you can see, this is the end of the road. This is where these children can go. And so very, very proud to continue to beat the drum and to support this wonderful organization. And this film is just a calling card to what is an ongoing battle until society realizes that change can be made and that we must deal with it and we must finance it and underwrite it and be supportive of it.
Tell us your name, where you're from, what your question is.
Hi, my name is Jenny and I'm from Simi Valley. All throughout the film and just right now, you talk about early intervention, early therapy. What happens to the families, I'll try to do this without crying, who don't get early diagnosis and don't get the early therapy? My son just turned 9. I mean, is there still hope?
Yeah.
Doctor?
Yeah, absolutely. I've never seen a microphone like this before, so I'm trying to figure out how to talk into it. Yeah, absolutely there is. Actually, what's really interesting is that there's about maybe 20 or 30 research articles on the subject of early intervention and about 2,000 research articles published on the subject of how ABA works with older individuals. So I think the whole concept of early intervention just became a real sort of fad and took the market, and everybody started talking about, wow, if we start with kids really early on, we can make the most impact. And perhaps that's true, but fact is that ABA is extremely effective with individuals. I mean, a research article, one of my students just published an article that showed that children starting between the ages of, I think, 7 and 13 do still incredibly well with ABA types of therapies. I just want to, I guess my perspective of autism, and I think you need to think about this, is that, like Lou mentioned actually earlier something that I thought was really accurate. Normalcy is not really a word that has limits. It's a spectrum. You talk about children with autism, and there are some children who are severely affected, other children who are mildly affected, and then closer to children who have ADHD, and then children who have just anxiety or maybe obsessive compulsive disorder, or adults. How many people here who have some obsessions? How many people here have anxiety?
Not everyone.
I mean, and so those are the types of, so it's sort of a spectrum, it's kind of a normal curve. And if you think about it in those terms, the concept or the goal for any child, for any individual, is to get them to be functional within the norms of society. And ABA is absolutely very, very effective with that concept, no matter what age you start at. So yeah, don't give up hope. One of the things, I mean, as I said, I think I said it on the film, I'm not sure, or maybe in the DV extras, but honestly, the experience you have as a parent of a special needs child is, and you can see the positive side of it being what Nancy said, which is you appreciate every step. You really do appreciate every step, and it's a joy, it's a pleasure. So don't fear, and just go for what you really want, and go for it,